I'm Alan Doederlein with the Depression and Bipolar Support Alliance. We're talking today about the different types of bipolar disorder with Dr. John Zajecka. Thank you for joining us.
Thank you.
When we talk about bipolar disorder, we're not talking about just one illness with one set of symptoms. What are the different types of bipolar disorder?
Currently, we see at least 3 types of bipolar disorder. There's bipolar 1, bipolar 2, and mixed states. Now, every one of those illnesses involves having depressive episodes, whether it's bipolar 1 or bipolar 2. That depression looks the same whether you have a unipolar major depression and you just have recurrent or chronic depressions, or if you have a bipolar 1 depression or bipolar 2 depression. The common signs and symptoms obviously could include things like just a sad mood, the inability to enjoy things, problems with sleep, appetite, energy. They can include even psychological symptoms like feeling hopeless, helpless, guilty, and even having suicidal thoughts. So everyone's depression can look the same. The difference in the classification is between bipolar 1 and bipolar 2 is bipolar 1, when someone becomes manic, they are functionally more impaired. It may result in a hospitalization. They may have been psychotic during their manic episode. But bottom line is, it resulted in some significant form of functional impairment. And there's a slight distinction because in bipolar 2 disorder, rather than becoming manic, the individual has hypomanias. It's not quite as severe. It still, though, may have some functional impairment, but not to the degree that one may have in bipolar 1 disorder. And then finally, in mixed states, the mixed states are individuals who have a combination of manic and depressive symptoms. And those include things like irritability, low frustration tolerance. They may feel racy inside, but at the same time feel very depressed, like the motor is always running. And so those are various classifications.
What's the difference between hypomania and mania?
You know, it's almost a matter of semantics, how the symptoms of mania differ from hypomania. You know, right now, the distinction is around how functionally impaired an individual may be. And it may actually be that both experience increased energy, irritability, they may at times feel euphoric, creative, but it's to what degree and how functionally impaired they may be as a result of it. Now, some people will say, okay, bipolar 2 is a less severe form of the illness. That's not necessarily true, because there are a lot of people out there who get by with having hypomanic symptoms that go unchecked. They can say, well, I just am more creative, I'm really more productive, I get by with less sleep. But what happens over time, those things start to catch up, and then they start making poor decisions potentially later on that causes problems. And so how you measure functional impairment is not just in the time in the moment, but it's actually over time as well. Now, one of the other most important things about bipolar disorder, the most common misdiagnosis is major depressive disorder. And because the depression in bipolar disorder, whether bipolar 1 or 2, looks the same as an individual with major depression, most people present with depressive symptoms. But as a clinician, I'm always very cognizant to make sure I ask about a history of hypomanic symptoms, using things like the mood disorder questionnaire, which is a self-rating report that an individual can fill out on their own, is something we developed many years ago. And you can just check off and look to see if clusters of manic or hypomanic symptoms may have occurred in the past. Because if someone comes in with a depression, the last thing that I want to do as a clinician is miss that diagnosis. And again, when people are depressed, they may not go back and want to remember what it was like when they felt good, because they may not be in that same mind frame. They may minimize the time when they felt really good, or minimize the time when they were, having a good time, making a lot of calls all night, very creative and productive, because in the moment they're depressed. And so it's important for us to go back and look at that history, because it is so common for people not to get the diagnosis at the start of treatment. There are a lot of people who are just misdiagnosed as having a depression, and then when their depression is difficult to treat, we realize sometimes not until sometimes years later that it's part of a bipolar disorder. Another common misdiagnosis is ADHD, attention deficit disorder. Because there's a very high comorbidity, meaning that the two illnesses can exist commonly together between bipolar disorder and attention deficit disorder, it's not unusual, especially early on in life, that someone is diagnosed with attention deficit disorder, but the mood gets missed. Because there is a lot of overlap between these symptoms, whether it's attention deficit disorder, whether it's depression, whether it's an anxiety disorder. Very important that good differential diagnosis is made. And for individuals out there who feel like their depression or their symptoms are not under good control, it's always good to seek out a second opinion. There's nothing wrong with that.
How is each type of bipolar disorder treated?
In bipolar disorder, a mood stabilizer really needs to be the foundation of at least the medicine treatments. If they do become depressed, the use of antidepressants may be warranted, but only once the individual is on a mood stabilizer, because there is evidence to suggest that antidepressants can cause someone to cycle into a mania, hypomania, or mixed state if they're not adequately treated first with a mood stabilizer. Now, in terms of the management, medication may be a basic foundation, but among the most important foundations is that the individual knows about the illness, that they're educated about it, that they're a participant in their treatment. That is truly the foundation of the best treatment for this illness. For many individuals, being in some form of psychotherapy can be very helpful in this illness. That therapy can be defined anywhere from having something like cognitive behavioral therapy, which is a very structured type of therapy, to basically just dealing with some of the life stressors or some of the life changes. That therapy is an option. And it doesn't mean it has to always be ongoing. It could sometimes be when someone may feel like an impending stressor, whether a good or bad thing, is coming into their life. It can be very helpful in terms of keeping things under good management with this illness. And additionally, having a good support system, whether it's with family, friends, certainly with your healthcare providers, but something that is really helpful for many individuals with this illness is being involved in some of the support groups. DBSA, for example, has a number of support groups around, and it may take someone to go to a few of them to find which one may fit best for them. These support groups could be so helpful in not only realizing you're not alone in this, but also that you can be well, you can get well, learning more about what the illness is, learning what some of the newer treatments are. I think the support groups can play a very vital role in not only getting to the point of wellness, but maintaining it and even growing.
Well, thank you, Dr. Zajecka, for providing some general information about bipolar disorder today.
Thank you.